I've spent a life seeing children with devastating conditions where there simply wasn't a solution. What I find most exciting is that's changing. And now, instead of just being able to tell parents, we know what's wrong with your child, when they ask, what can you do about it, we have an answer.
Children's Medical Research Institute was founded 65 years ago as Australia's first paediatric research institute, the first research organisation in Australia solely devoted to children's health. So by focusing on inherited diseases and gene therapy and stem cells and on cancer, we're really addressing the major areas of unmet need for children. It's incredibly exciting to be part of an organisation that leads the nation in gene therapy research and has produced a world-first database that will help cancer clinicians choose the best treatment for cancer patients first time. As exciting as all of the developments are in gene therapy, we're really only at the beginning.
So the idea of gene therapy is relatively simple. It's the use of genes as medicine. So if a damaged gene is causing disease, if you could repair and replace it, then you could treat the disease. And some of the particularly memorable events in my life have been standing at the bedside when a child is getting a newly developed therapy. And an example of that was spinal muscular atrophy. So seeing a child that formerly would have been doomed to potentially pass away by the time they're 18 months or 2 years of age, receive therapy, standing there with the parents, full of hope, excited that the field had reached this point. That's extremely memorable.
I can remember one Tuesday afternoon, late Tuesday afternoon, a mother arriving in my practice with two young children, Riley and Saman. And the mother thought that the older one, Riley, had a serious vision problem. She wasn't sure about the younger boy. I examined both boys and both had all the clinical features of Leber's amaurosis. A child can be born with very, very poor vision, and the little vision that they have, they would lose in the first decade of their life. And there was absolutely nothing we could do about it. So I had to deliver to this mother. She was on her own. The devastating news that her two boys are going to lose the little sight they had at this stage. Then I started to hear about they were doing research into gene therapy. I arranged for them to have genetic testing. That was done here through CMRI with Robin Jamieson.
Well, I saw Riley and Saman very early on to try and understand the genetic diagnosis in them. And I was really proud that our iGenetics research team was able to help facilitate genetic diagnosis, and that really put them on the path towards that gene therapy approach. And I led a team across Australia, Ocular Gene and Cell Therapies Australia, where we really worked with all the team members that are needed for delivery of that gene therapy. And so that was a really amazing thing that we were able to do, and that was an Australian first.
About a year after the treatment, I saw Saman sitting in my waiting room, and he had no cane. So I called Saman in. I said, how'd you come in here? Oh, I came in on the train. I said, who came with you? No one. So we sat down. I said, how's life? He said, it's changed. So I can see stars. He said, I can get around on my own. So here's with gene therapy, Saman's life had been transformed from being totally dependent, about to drop out of school, getting on with his education and looking forward to leading a very, very productive life. I would love to see Westmead, Sydney, Australia lead the way in gene therapy. We've got superb scientists, not only in the gene therapy, but other areas, stem cell. We've gone into regenerative medicine, and we've got an outstanding researcher who can, from a single cell, grow a heart or grow a liver, then we can look for treatments that will fix diseases in the heart or the liver.
Basically, we obtain a blood sample or a skin sample from a patient or a healthy individual. We take it back to the lab, we grow these cells, and we can then induce these cells to become stem cells, and they can give rise to any cell type in your body. I guess the beauty is that you have it from a patient. So the genetic defects that that patient has is now preserved in the stem cell. And we can then study that disease in the dish and develop new treatments. They will generate these mini organs. For example, a heart that beats, an eye that can sense light, a neural that has activity as a normal neuron will have. I really want to one day be able to transplant healthy cells in children that are going blind and hopefully help with their vision.
It's incredibly exciting to be at the point now where there are children who are running and jumping who otherwise would have perished without gene therapy. But behind every one of these diseases is a real human story of children who are seriously affected and the families who care for them. Children like Charlize and Teddy. It's a tremendous privilege to meet some of these children and their families and know that the research that we're doing is going to have a major impact. Our dream is to utilise this amazing technology to help as many children and their families as we possibly can. And we're just incredibly grateful for all the support we get from the community to help us on this journey.